So, we got the frontal bone, oops. Okay, so you got the frontal bone. Okay, so on top, you got the frontalis muscle, okay? Posterior, right? Posterior, you got the occipitalis muscle. So it makes the occipital-frontalis muscle group, okay? Then, right, the muscle around the eye, right? It orbits the eye, so it's the apicularis oculi, okay? Closes the eye. Okay, antagonistic to that is the levator palpebrae superioris, okay? It's gonna open the eye, it's gonna open the eye. The orbicularis oris closes the lips over the teeth, okay? And the levator labii superioris, it tells you where it is, okay? It tells you what it does, it elevates the lips and it's on the superior side of the mouth, okay? The depressor labii inferioris, right, is going to depress the lips or make you frown, okay? The depressor anguli oris angles it. So, you know, in a multiple choice test, muscles are actually fairly simple. Okay, mentalis makes you pout, okay? And the zygomaticus major and minor, they curl the lips up, so it makes you smile. Zygomaticus major and minor make you smile, and resorius gives you like that fake type smile, the fake smile, okay? Underneath here, you got the buccinator muscle, it's a little deep, this makes you pucker. Okay, so, right, you have to pucker to blow a bugle, right? So the buccinator blows the bugle, a little bit like that. Okay? And that's basically it for muscle of the face, so we'll do that pretty fast. Okay? Okay, so now the muscles of chewing, know those. And the back of that white book that I did, okay, that chapter is like three and a half pages, all the muscles you need to know. It gives you the muscle, and it gives you the action, okay? I might go over origin and insertion with you, but I'm not gonna test you on that, okay? All right, so temporalis muscle and massa, right, these are muscles of chewing, muscles of mastication, so you need to know mastication means chewing, okay? So just think time to eat, So the T in time is the temporalis muscle, okay? It's gonna elevate the mandible, okay, and retract the mandible. Okay, the M in time, right, is the masseter, same thing. Elevates the mandible and retracts it, elevates and retracts it, okay? So we gotta go a little deeper, so I gotta go ahead here. Okay, so here in this picture, I cut the temporalis muscle, removed the masseter muscle, cut the zygomatic artery off the zygomatic bone, and cut a little bit of the mandible there. Okay, so right here is gonna be the I, okay, it stands for internal pterygoid, which we're calling medial now. So anything that was internal, right now, they're calling medial, anything that was external, they're calling lateral. Okay, so I messed up my mnemonic a little bit, okay? So the medial pterygoid muscle is gonna elevate the mandible, it's gonna protract it, and it's gonna move from side to side. Okay, the lateral or external pterygoid muscle opens the mouth. It depresses the jaw and moves the jaw from side to side, okay? All right. So let's go to the eye, okay? So remember, right, the eyeball, okay, it's named for where it originates in the eye socket, okay? So where the muscle originates, okay? So, right, except for the oblique. So the medial rectus, right, it originates in the medial eye orbit, but it inserts it to the eyeball. So when it contracts, it rolls the eyeball in, or medially. The lateral rectus muscle is in the lateral socket, okay, eye orbit, okay, and it attaches to the eye. When it contracts, it goes laterally. Superior rectus goes up and in, inferior rectus goes down and in, okay? The obliques are different, okay? So you're looking towards the outside, you're looking lateral, okay? So if you're looking towards the outside, you know it's gonna be oblique. O for outside, O for oblique, and O for opposite of what you would think. So the superior oblique, right, it originates superiorly in the eye orbit, goes on this little trochlea, like this little pulley, and it attaches in the back. So it contracts or goes down and out. So if something's going down and out, you know, it's superior oblique, it's the opposite of what you would think. Inferior oblique's on the bottom, okay, but when it rolls the eyeball, it goes up and out, okay? So So you think O for oblique, O for going towards the outside, and opposite of what you would think, okay? All right? Okay, know the muscles of the tongue, okay, that's important also, okay? These are incredibly easy because it gives you origin, insertion, and then you know the action, okay? So, the styloglossus muscle goes from the styloid process to the tongue. So, pulls the tongue in. Genioglossus, chin to the tongue, sticks the tongue out, okay? Palatoglossus, right, palatine process, roof of the mouth, okay, goes right under the tongue, elevates the tongue. And hyoglossus, hyoid bone to the tongue, okay, it depresses the tongue. So it tells you where it is, you know where it is, you know what it does, because muscles pull, they don't push, okay? All right, let me go up, a little easier. Okay, so your sternocleidomastoid muscle, when it contracts unilaterally, so it means one side, it turns your head to the opposite direction. When they both contract, okay, it's gonna aid flexion of the chin to the chest, okay? We go in the back, okay, the trapezius muscle looks like a trapezoid, okay? So that goes to the base of the occipital bone, down to the spinous scapula, all the way down to T12. So if you follow the fibers, it's gonna elevate the scapula, depress the scapula, and retract the scapula, okay? Right? Since we're here, the latissimus dorsi muscle is a big muscle in the back. It does nothing for the back, it's all arm movement, okay? So it's gonna originate at the spinous process at T7 and go all the way down to the sacrum. It's going to insert in the intertubercular sulcus of the humerus. So it's gonna extend the humerus, internally rotate the humerus, and abduct the humerus, okay? Back. Okay, so the main muscle of breathing is gonna be your diaphragm. That's the main muscle of breathing, okay? What also aids in breathing, okay, is gonna be your external intercostals and your internal. External intercostals, like your fingers going in your pocket or grabbing your ribs, the fibers. Okay, so when they pull up on the ribs, when they contract, so it's gonna make the thoracic cavity larger, so air's going in, okay? So if you go in here, your external intercostal muscles make you inhale. Your external intercostal muscles make you inhale, okay? Whoops, which way do I go? Okay. All right, your internal intercostal muscles are the opposite way. So they're gonna pull the ribs down, okay? So it's like squeezing a balloon, so air's gonna come out, okay? So your internal intercostal muscles make you exhale. Internal intercostal muscles make you exhale, okay? Okay, your rectus abdominis muscle, okay, makes you flex your trunk. You flex your trunk, it compresses the abdomen, okay? It's gonna rotate, laterally flex, help you have a bowel movement, help you urinate, okay, and also push out babies during labor, okay? Your quadratus labiorum muscles make you extend the trunk, okay? Your internal external oblique muscles make you rotate and laterally flex, and the transverse abdominis muscle, it just compresses the abdomen, so it's not a very, very strong muscle, okay? Okay, so the deltoid muscle originates at the clavicle and the spine of the scapula, and it inserts in the deltoid tuberosity. So the deltoid muscle abducts the humerus, okay? You go up again, show what else was there. The big chest muscle is the pectoralis major muscle, originates at the sternum, inserts in that intertubercular sulcus, so it makes you do horizontal abduction, okay? And what? Also abduction, and your pectoralis minor muscle, it pulls the scapula anteriorly and inferiorly, but it also aids in deep inspiration. It's like the scalene muscle, so it pulls everything up, okay? So again, it can originate in rib 2, 3, and 4, 3, 4, and 5, or 2, 3, 4, and 5. and it attaches to the coracoid process of the scapula. And let's go back here. All right, so know the muscles again of the rotator cuff. The think sits. So the first S is supraspinatus. Okay, it's gonna initiate abduction of the humerus, and then the deltoid muscle takes over. Okay, then you have the I, which is the inferior, your infraspinatus, because it's inferior to the spinal scapula. So the infraspinatus muscle, that's going to originate at the vertebral border and attach in the posterior greater tubercle. Okay, the supraspinatus, right, vertebral border and the top of the greater tubercle. Okay, so and then you have the teres minor that originates at that axillary border and it's going to attach to the posterior greater tubercle of the humerus. So the infraspinatus and teres minor do the same action. They externally or laterally rotate the humerus. Okay? If you're looking at the subscapularis, okay, that's the second S, that's going to originate at the vertebral border, but on the anterior side of the scapula, and it's going to insert in that, it's tuberculous sulcus. So it's going to do internal or medial rotation. Okay? Now the teres major they consider not part of the rotator cuff, but that also does internal rotation, okay, or medial rotation. That's going to originate at that inferior angle of the scapula and insert in that tuberculous sulcus. Okay? All right. So the muscle on the top, right, of the humerus is going to be the biceps brachii muscle. Because it originates, the short head originates at the coracoid process of the scapula. The long head originates at that glenoid fossa. Here the scapula goes right through there into the tuberculous sulcus, which you also call the bicipital groove. Okay? And then it's going to insert into the radius. So it does flexion and supination. Flexion and supination. Okay? So remember we said talk about stabilizers? Look at the tendon and the pectoralis major muscle. Stabilizes the biceps brachii muscle. Okay? Okay. Underneath the biceps brachii muscle, okay, is the brachialis muscle. Brachialis muscle originates at the humerus and inserts in the ulna. Okay, it's going to insert in the ulna here. Okay, it just strictly does flexion, Okay, so we go back, whoops. Okay, so the biceps brachii and brachialis muscle flexes the forearm at the elbow joint. Okay, so what extends? Triceps brachii. It's got three heads. Got a lateral head, okay? It's got a medial head, and it's got a long head. Okay, so the triceps brachii muscle does, it extends the arm and also the forearm. Extends the arm and forearm. Aconius just does the forearm. Okay? Now we're in, so if you look at, again, I don't have an anterior view, okay, but these are actually really easy because they tell you what they do to tell you where they're located. So if I want to flex my wrist, okay, those are the flexor carpi muscles. Flexor carpi, it tells you, okay? So on the lateral side, right, anatomical position, it's the flexor carpi radialis, flexed it. On the medial side, it's the flexor carpi ulnaris. They both flex the wrist, okay? And palmaris longus goes to the palm, flex the wrist, okay? They're a little deep on the posterior side, okay, but if I want to extend my wrist, extensor carpi radialis, okay, you have a longus and a brevis with extension, okay, you got extensor carpi ulnaris, okay? If I'm flexing my fingers, okay, flexor digitorum, it tells you what they do, okay? On the palmar side, you got flexor digitorum superficialis. Those muscles go to the middle bone, okay? So superficialis, it's superficial. Okay, and then deeper, right, flexor digitorum profundus, right? Profundus means deep, goes to the distal bones. Again, which you flex your fingers. Anything pollicis is the big thumb. Okay, it's the big thumb, it is the thumb. Okay, so, distal joint, right? Flexor pollicis, extensor pollicis, proximal joint, adductor pollicis, abductor pollicis, okay? And then opponent's pollicis does opposition, okay? So that's fairly simple. If you go in, posterior fingers, okay, or phalanges, right, you got the extensor digitorum muscles, right, the whole group here, okay, extensor digitorum. Right here, extensor digiti minimi muscle, follow the tendon, right, just gonna put the fifth phalange, and a little deeper, extensor indices, makes you point your finger, okay, all right, and you got your extensor pollicis right here, okay, so they go to the distal joint, okay. The dorsal interosseous muscles, abduct the fingers, right? Abduct the fingers, okay? And then your palmar interosseous muscles, okay? They're gonna adduct the fingers, okay? All right. Don't worry about the small deeper muscles here. Just know this is why you shouldn't lift with your back, okay? Scalene muscles, when they contract unilaterally, the anterior and middle, okay, it's gonna flex the cervical region, okay, it's gonna rotate and laterally flex the cervical region. Okay? All right, so for the lower extremity, it's actually fairly easy. Just group them, okay, so everything's grouped in my little book, it makes life a lot easier, okay? All right, so the muscles that flex the thigh at the hip joint. The muscles that flex the thigh at the hip joint, okay, it's gonna be the iliacus muscle and the psoas major and minor muscles. Most people do not have a minor, okay? Most people don't have a minor, okay? Iliacus goes from the iliac crest to the femur, okay? Psoas major goes from the transverse process of the lumbar region and T12, okay, and goes into the femur. And then just T12 is the psoas minor, okay? So they flex the thigh at the hip joint. So what extends the thigh at the hip joint? Gluteus maximus muscle, So it goes from that posterior portion of that, of the iliac crest, and it inserts into the posterior portion of the femur, okay? So they're gonna extend, okay? So if we go back, okay, what abducts the thigh at the hip joint, right? It's gonna be your tensor fasciolata, okay? And your gluteus medius and minimus muscles, Don't worry about the obturator externus and internus or the gemelli muscle, superior inferior gemelli. The only thing with the rotation is the piriformis muscle, because if that goes into spasm, okay, it could affect the sciatic nerve. Okay, do your sciatic nerve. Okay, that's what we're going to let you know for that. Okay, so gluteus medius and minimus, abduct, and tensor fasciolata, abduct, okay, the thigh at the hip joint. So what adducts the thigh at the hip joint? Well, you adductus magnus here, longus, which is cut, brevis means short, so longus means long, brevis means short, gracilis and pectineus. So a lot of big muscles there, Okay, all right. Let's see. Okay, so the muscles that extend the leg at the knee, okay, these are synergistic to each other, right? They all work together to extend the leg at the knee. These are a quadricep muscle group. Quads mean four. Quad means four. So here on top you have your rectus femoris muscle. On the lateral side, vastus lateralis muscle. In between or underneath the rectus femoris, vastus intermedius, and vastus medialis is on the medial side. Okay? Then you have your sartorius muscle. That's the longest muscle in the body. It goes from the anterior superior iliac spine to the ilium and attaches to that tibia tuberosity. So it externally rotates and flexes the leg at the knee. Okay, so the opposite of extension of the leg at the knee. So those muscles will be antagonistic to the extensors. It's going to be our flexor muscles. Okay, so these are our hamstring muscles. Okay, so they all originate at those ischial tuberosities. Going laterally is the biceps femoris muscle. Medially on the bottom is going to be semimembranosus, okay, and semitendinosus lays on top. Okay, so the biceps femoris goes laterally and inserts on the head of the fibula, the membranosus and tendinosus attached to the tibia, okay? Okay, if you go down, to the leg, so the anterior tibial, the tibialis anterior muscle is going to dorsiflex the foot, make you come up on your heel, and invert the foot, make you look at your instep. So that's tibialis anterior. So the opposite of foot inversion, right, looking at your instep, is going to be eversion, looking at the side of your foot. Everts the foot is fibularis longus and brevis. Okay, if you're talking to an older person, okay, it's going to be, they might call fibularis peroneus. Okay, peroneus is a Greek word. They want to give you more Latin now. Okay, so tibialis anterior again, right? It dorsiflexes the foot. Okay, so plantar flexion would be opposite. You go on your toes. It's going to be your gastrocnemius and soleus muscles. Okay, most people do not have a plantaris. Okay, if you're looking at the toes, same thing. Flexor digitorum, flex the toes. Extensor extends the toes. Anytime you see hallucis, that's the big toe. So flexor hallucis, flexes the big toe. Extensor hallucis, extends the big toe. So in a multiple choice test, it's actually very easy. Okay, and that's it. That's it for muscles. So keep reviewing those. The more you go over it, the easier it gets. Okay. All right. We'll start blood today. I'm just going to go over a couple slides of blood, and we'll finish that up tomorrow. So, this is chapter 19. Okay. So some of this stuff it was never fixed, but it says like class 14 or lecture for. Don't worry about that. I sent everything to you. It all comes up. So chapter 19. So chapter 19 is the last chapter that we got to do for lecture test number 2. Okay, that's the second week of November. So next week I'll give you a review on everything, and the following week. Okay, all right. And then that's in November, and then it goes quick. And in December you get the second lab test, and you get your final. Final's not cumulative. Okay, chapters 12 through 18 is all nervous system. In this school we do that in anything too. Okay, we do it.
So the test is from chapter.
This goes 8, 9, 10, 11, and 19. Yeah. Okay. All right. Hey, guys, when I was in school, you have a midterm and a final, and the midterm is worth 70% of the grade. So even if you had A's going into your finals, you could have 3 finals in one day, and you could drop from that A. Okay? So you had two lecture tests and two lab tests. And all the lab tests are practicals. I mean, you came in at different times, so you couldn't fit that many people in the room at different times. Okay. Oh, and in those days, there was no missing a test. No missing a test. If you missed a test, it was a 0, and you failed the class, you had to go. No if, ands, or buts. They didn't give a shit. They did. I remember when I went to chiropractic school, it was the first day of gross dissection. That's for the cadaver. It was, I forgot his name though, Dr. Kane. He was bald, but he had red hair and a little red mustache. Okay, this is what he did. He came in the first day of class and started at 7 in the morning. Okay, he goes, you get here at 7. I'm shutting the door and locking it. So he would be with his watch. 3 people would run down the hallway. I'm here. Slam the door. He yelled, don't give a shit. Slam the door. So you missed 1. If you missed 2, you dropped the letter grade. In chiropractic school, there was no pluses or minuses. It went A, B, C, F. Because of the D, you had to do it anyway. So when A, B, C, F. If you missed 1 class, that was okay. If you missed 2 classes, you dropped the whole letter grade. If you missed 3, you failed the class. Nobody cared. And he said, he goes, I don't care if you have 1 car and your wife has to work. I don't care if little Johnny's got to get to daycare. He goes, I don't care if your mother needs dialysis. You get here, you fail the class. And that's how it was. Okay, so now when you went in for dissection, he would tell you, okay, learn the gastrointestinal tract. Have fun, go to his office, read the paper. So, but it was like you start at 7, you end at 12. So after a couple hours, you get up, you go around a cadaver, and you call your name, right? So if you call your name, he said, go through all the organs. And if you went, you're fired, 0, what's your name? And you have to go through it. That's how it was, this class, okay, being a-hole. So, I graduate, I'm getting ready to leave to go home, okay? I'm licensed in 3 states, right? New York, Pennsylvania, New Jersey, so around the same area, okay? And I'm getting ready to leave, I'm working for a chiropractor, but I'm getting ready to move back to New Jersey, okay? So we're just about to move, okay? In those days, Georgia only needed a back license plate. You need 2 license plates. So I said, come here, my wife, come here, we gotta run to the chiropractic school for a second. She goes, why? I said, I gotta say goodbye to somebody. So I'm waiting, right, so Dr. Kane comes out. So what I did was I took a piece of cardboard and I taped it on the license plate, so you couldn't get my license plate number. So, and where do I go? Hey, so you didn't know anybody. I go, hey, Dr. Kane, you picked a good profession, dealing with the dead because you can't deal with the humans. You're an asshole. Well, what's your name? You're out here. Give me your ID card. I'm running like this. I get to the car, my wife takes off. She goes, that was nice, Doc. You die happy now? I said, yes, I can. Nice going, Doc. So I was doctor. So, well, licensed doctor and everything. Yeah. Dr. Kane. Yeah. He hated everybody. So, but that's how they were. That's exactly it. They didn't care. Okay. So, this is cardiovascular disease on the cardiovascular system. So we're gonna do blood. So the cardiovascular system consists of the heart, and the heart's gonna pump the blood through the blood vessels, okay? Through the blood vessels. So know the functions, okay? So the blood is gonna transport oxygen and nutrients to the cells of the body, okay? And it's gonna transport waste products and carbon dioxide away from the cells of the body, okay? So what does this is your red blood cells. The hemoglobin on a red blood cell is gonna carry oxygen and also carbon dioxide. That's important. A lot of people mess that up, okay? Okay, blood regulates our pH, so the globin portion of the hemoglobin molecule, that protein portion is a great buffer. We'll actually see that next semester, and we'll do experiments with that too. Okay, and it's gonna regulate temperature. So our blood vessels dilate when we're hot, and it brings the blood to the top portion of the dermis of the skin, so we can dissipate that heat. Okay, so people that have very, very light skin, fair skin, you can see they get red when they get hot. Okay, and blood's also gonna protect us. Okay, so it's gonna prevent the loss of blood through clotting. Okay, that's gonna be our thrombocytes or our platelets do that. And we'll also combat microorganisms by fighting infections. Okay, your white blood cells or leukocytes do that. Okay, I'm gonna run through all those different cells. Okay, know the characteristics of blood. Okay, so the viscosity is thicker than water. So blood's thicker than water. Okay, that's because of those formed elements. Okay, temperature of blood is 100 degrees Fahrenheit, okay, or 38 degrees Celsius. So when you bleed, it feels warm. It feels warm. So they first came out those digital thermometers that you put on the head. So when my daughter was born, we got one of these things, and the thing was broken. It didn't work. So you know, babies get fevers all the time, and the first one, so my wife's like freaking out all the time. So she calls, she goes, take the baby's temperature again. I'm like, you know, the kid doesn't need the temperature taken again. So I took it and I go, this thing's broken. She goes, it's not broken. I go, Shelly, if you have to call me at the office every time you take the kid's temperature so I could convert Celsius to Fahrenheit for you, the friggin' thing's broken, right? She goes, it's not broken. I go, hold on. I slam it on the ground. I go, it's broken now. She goes, yeah, it was $200. I'm like, oof. No, the best way to get a temperature for the baby's an anal thermometer. That's what I thought. The anal thermometer, put it in, and you got a really good reading there. Okay? Okay, but with the mercury in the glass, they don't really use it anymore. The new thermometers that they put on the heads are actually very, very accurate now. Okay? Used to use a mercury one. Used to put it under your tongue. It worked great. It worked great. You know what the difference between an anal thermometer is and an oral thermometer? The taste. You know, I didn't think about that. Okay. Actually, the front was different. One was more pointy and one was rounded. was all mercury in it, and it worked great. And it worked great. Nobody got hurt. You know, if you broke it and you licked the mercury, okay, then it's dangerous. If you don't lick the mercury, if it doesn't get in your body, you're fine. You should play with. Mercury's a metal that's liquid at room temperature. It was great to play with. I don't say don't play with it. I don't even think you can find mercury. Yeah. The break, you used to hold it, and you should play with it. As long as you didn't have a cut on your hand and you didn't ingest it, you were fine. You were fine. You should pick it up with you, clean up with Windex cards. Okay? You should do that with that and thermometers and also blood pressure machines too. Okay, but they don't do it. So, then what are you gonna do? They used to take mercury and if you had a sexually transmitted disease like syphilis, okay, there was really no cure for it. They didn't even really know what it was, okay? And it's bacteria. So what they would do is they would take a syringe and it would take mercury and they would shoot it up your urethra, thinking it would kill the disease. And it actually didn't, and you would easily die of kidney failure or heavy metal poisoning, mercury poisoning. And it would turn your teeth silver. So if you smile and you had silver teeth, people knew that you were with like unclean people, right? And they used to say, you spend one night with Venus and the rest of your life with Mercury. Get it? Yeah, that was the standard of care. They had nothing else. They had nothing else. All right. We have a brand new digital thermometer, so we teach you vital signs this semester. You'll be the first class actually using those, okay? Last year was supposed to be the first class, but they take 9-volt batteries. Evidently, 9-volt batteries are incredibly expensive. I don't shop in the house, my wife does, and I'll go buy batteries. She gets them. When the shipment came in, somebody went into the prep room and stole all the 9-volt batteries. I take them out, I go, how come these aren't working? I go, they don't come with batteries? Then I look, there's a little piece of the battery. So I read the directions, 9-volt battery included. And all the tops were cut, the little plastic thing was cut over. Yeah, so someone stole all the batteries. So we got new batteries, so we work with those. We just got brand new electric blood pressure machines that they have in hospitals and all. They're $1,000 a piece. We got a bunch of those. So my mother went to the neurologist the other day, and the tech came in and had one of those. So the mother goes, hey, we just got those at the college. Right? I go, they're $1,000 a piece. The girl goes, wow, I probably shouldn't be banging around so much. Probably not. They're expensive. Okay, so this is very important. The pH of blood, okay, is 7.35 to 7.45. Not a big range here, right? So if you fall below 7.35, you're going to go into a state of acidosis, your blood, okay? If you go over 7.45, you're going to go into a state of alkalosis. Okay, both very damaging to cells. Both very, very damaging to cells. Okay? Right. Blood volume, depending male or female, right? 5.6 liters in males, 4.5 in females, because muscle has a lot of blood supply. So women have less muscle to fat ratio than males. They have more fat to muscle ratio than males. You got more fat soluble hormones. Okay? Where you can get a blood sample. Venipuncture, that's when they go in your arm, right, superficial. Okay, finger stick, if you're looking for like blood glucose levels and all. Arterial sticks tend to be a little painful because they gotta go deep. Okay, they gotta get to the artery. Okay, usually when they mainline you, like the medication in your artery, to do it in there. Okay, plasma is gonna be the extracellular fluid in blood, about 55% of blood. The other 45% is formed elements, your red blood cells, your white blood cells, your platelets. Okay, plasma is going to be mostly, it's 92% water. Okay, some books say 91.5, it doesn't matter. The other 8%, okay, is going to be electrolytes, nutrients, protein. Okay, so 99% of these formed elements are going to be the red blood cells, RBCs. It's why your blood's red. Okay, it's because the hemoglobin molecule, heme is iron, iron is red. Okay, that's why stuff that rusts turns red. Okay, all right? So if I took blood and put it in a test tube, put it in a centrifuge machine, it's a machine that spins it really, really fast, all the solids go to the bottom. Okay, so all your red blood cells go to the bottom, Your white blood cells and platelets will be like this little tiny little buffy coat here, and then the rest will be plasma. So during, right in between World War I and World War II, they developed this technique. Saved a lot of lives on the battlefield because the medics could carry just plasma, okay? And if somebody got injured, okay, and they were bleeding out, they could give them whole plasma to raise their blood volume, and they would survive until they got into a hospital, where they could give them a transfusion, okay? The only problem was that they had them in glass bottles, because there was no such thing as plastic in those days, okay? So they had them in glass bottles, which made them very, very heavy, and they broke very, very easily on the battlefield. You know, they came with plastic, carry more, they're more durable now, okay? All right, let me just go here, it's a little easier. So whole blood's about 8% of our total body weight. So again, it's 55% plasma and 45% all these little cells in here. So it's gonna be about 92% water, our plasma, okay? The other 7% is gonna be our protein, so albumin, okay, that's the most abundant protein in our body. Globulins, these are gonna make our antibodies to fight infection, and fibrinogen is gonna help us clot blood, okay? The other substance is gonna be our electrolytes, sodium, potassium, magnesium, nutrients, okay, like glucose, respiratory gases, nitric oxide, you need to make blood. Regulatory substances are gonna be our hormones and of course waste products. Okay, our red blood cells, okay, we have 4.8 to 5.4 million red blood cells per unit liter of blood. This is why blood's red, okay? Blood is not blue until it hits air. I don't know why they teach that in high school. So some high schools do. That is totally untrue, okay? Blood that is very, very oxygenated is very, very bright red, okay? Blood that is deoxygenated, which means full of CO2, is like a crimson color, okay? So if you have like some sort of respiratory problem, okay, and you're building up CO2, it's gonna get more and more crimson, so your skin's gonna turn blue, okay? And the reason why your veins look like they're blue is because of the fat in the skin, okay? If you have a little darker skin, it might even look green, okay? You just have the light's refracted, okay? Like, so it's not blue. The only animal I know that has blue blood is a horseshoe crab, because it's copper in its blood. It has copper in it, okay? It's copper in it, okay? You guys know what a horseshoe crab looks like? Horseshoe crab never evolved. Like 10 million years ago, it became a horseshoe crab, and it never changed. That's a species of animal that's really comfortable with itself, right? It's like, hey, we're pretty cool. We're not changing. I guess a horseshoe crab's gonna look into another horseshoe crab because they're baby horseshoe crabs, right? So, you ever go to Jenkinson's Aquarium in Point Pleasant? If you can get a chance to go, it's a great aquarium. And they have like this touching thing upstairs. You walk upstairs, and they have like all the kids like really interactive. So my daughter was little. I forget how old she was. Probably like maybe my son was still in the carriage, so he getting carried around. So I go upstairs with my daughter, and I go, look, Juliette, the man's got a horseshoe crab. So he goes, would you like to hold it? She goes, sure. So she's holding the horseshoe crab. So my wife walks up the stairs with my son, and she goes, look, Mommy, I'm holding a horseshoe crab. My freaking wife screams and runs back downstairs. That's my wife, yeah. My wife is kind of like from the city, and I'm like from the country, and yeah, I go into petting zoos, and I'll feed the animal right out of my mouth. I go, here, come on, right? My wife is like with the freaking Purell all over the kids and shit. I'm like, dude, relax, it's okay. The thing's not gonna bite you, come on. Yeah. My wife's not real big in animals, yeah. Which is probably a good thing, because if she wasn't like that, I would have all shit running around my house. Yeah, I don't know, running around my house. Yeah. All right, so we have 4.5.4 million red blood cells. We have 150 to 400,000 platelets. Okay, these are gonna help us clot blood. Okay, so red blood cells are called erythrocytes. Platelets are called thrombocytes. We're gonna go over all this later. Okay, white blood cells, we have 5 to 10,000. So if you have a white blood cell count of like 30,000, you got an infection somewhere. Okay, so we got to investigate that. Okay, all right. Our white blood cells, we have two main types: granular leukocytes. They have a grainy appearance. So in order of abundance, right, we have neutrophils, and then we have eosinophils. Basophils, we got like 0.01%. Okay, those. And then we have agranular leukocytes that look very, very smooth under the microscope. These are going to be our B lymphocytes, our T lymphocytes, our B cells and T cells, okay, and our monocytes. Okay, all right, so let's go to here. So hemopoiesis, poiesis means to make, so he means blood. So hematology is the study of blood, okay? It's the study of blood, okay? So, when you're a fetus, right, your liver can make the blood, but then your red blood cells do, okay? I mean, your red bone marrow does. So red bone marrow is at the end of long bones and in flat bones, okay, and in flat bones, okay? All blood cells start out as pluripotent stem cells. They all start out as pluripotent stem cells. Then they divide either into myeloid stem cells or lymphoid stem cells. This is where the genetic defect happens with leukemia. So you either have myeloid leukemia or lymphoid leukemia, okay? Right? So if you're gonna do a bone marrow aspiration, get a sample. It's like a little tube, it's like a little gun that gets shot in, and you take a little piece out. Bone aspiration, a little more invasive, it's like a little ice cream scooper. You scoop out more of the sample. And bone marrow biopsies and aspirations are good to detect why you're anemic, okay? So anemia is you're either not making red blood cells or you're losing them, and you can be bleeding somewhere, okay? Leukemia is a type of cancer where your T cells attack your red blood cells. So your red blood cells fall so far, they get so diminished that you'll die, or could die. So they treat this with bone marrow transplants, okay? And a lot of times it does work, sometimes it does. Again, so anemia is very common, especially in females during the cycle. It may be an iron deficiency or a B12. So we're gonna see, in order to make red blood cells, you need iron, that's the heme portion, the hemoglobin. Okay, you need the protein, and you need vitamin B12. You need vitamin B12. So vitamin B12, you get from the food you eat, like your red meat, you get it from eggs and stuff. Okay, in your stomach, you have parietal cells that relieves a chemical called intrinsic factor. Intrinsic factor allows you to absorb vitamin B12 from your diet, okay? As you get older, some people don't make intrinsic factor, okay? So they don't absorb vitamin B12. So they can get it with an IV, okay? They can get it through an IV, okay? Like a shot, okay? So, like you say, your grandma, grandpa's feeling a little sluggish, they need a B12 shot, this is why. So you jump it over the digestive system, and put it right in the circulatory system, okay? So for the most part, with anemia, you probably just don't have enough iron in your diet. So I'll tell you to eat more spinach. Spinach is very, very high in iron, or they just might give you an iron supplement, or they might give you a B12 supplement with the iron, okay? But anemia's got nothing to do with leukemia, okay? So I had a student one time, she donated blood, right? The blood truck came on campus, she donated blood, and they told her, go see a doctor, you probably have anemia. She goes home, and she tells her father, who's brand new in the country, right, first generation she was, and she says, they said I have anemia, and he hears leukemia, and his brother died of that, whatever country they were in, okay? Next day, she comes to my class, and she's standing outside the hall, and she's crying. I go, what's the matter? She goes, I think I have leukemia. I go, what do you think I have leukemia? Like, I said, no. And I go, what happened? She goes, I donated blood. I went, you probably have anemia. And I said, you have a family doctor? Yeah. I go, give me his number. I called him, right in the office, she stayed there. I go, I got one of your patients. I said, Dr. Batsey, how you doing, Dr. Whatever. He told me right away. It's pretty cool. He goes, that was when you could, those days you could actually talk to a doctor, and I get to like the front desk. That it's like, you know, God forbid you talk to him. It's like I talk to the Wizard of Oz. So no, I just Dr. Batsey, put him on the freaking phone, and then put him on the phone. And you gotta pull your title. And I very rarely do that. Lately I have been. You can't get hold of anybody. And then when you get into the room, the doctor goes, well, why didn't you call me? I can't get through. You're like the Wizard of Oz. I can't get through the green gate over there. And they laugh. I go, well, it's really not funny. How come you waited so long to get an appointment? Because it was 2 months your lady gave me. So, anyway, I digress. Okay, so he was real chill. He goes, no, try just anemia. Have her come in. Had her come in today, took a blood test, she's anemic. I said, listen, what's it gonna do? I said, she's probably gonna take you to eat spinach and go back in a month. Okay? It's always gonna give you a supplement. She came back and says, yeah, I gotta go buy spinach. It was easy to get. So don't get freaked out. Just go get it checked. This is not the scale. Okay, this is not the scale. Okay, red blood cells, when you look at it under the microscope, you're gonna see your focal field of view, and you scan through your focal field of view, you'll see all red blood cells, okay? Red blood cells are incredibly small, So they're very, very hard to see even under 400 times, okay? They look like little pink Cheerios, okay? Because they're biconcave, so it looks like they're hollow in the middle, they're really not, okay? Red blood cells are also called erythrocytes. They last 120 days, and their job is to carry oxygen and CO2. Okay, so for the test, tell me what their names are, how long they live, and what their function is, and we will go over all of that tomorrow, okay? Okay? All right? Platelets are called thrombocytes. They live 5 to 9 days. Okay, because they both don't have nuclei. And platelets are actually cell fragments. Okay, what they do is they clot blood. So thrombocytes, okay, cyte means cell, throm means the clot. Okay, white blood cells are big. Okay, remember you only have between 5 and 10,000, so you could be going through your focal field of view and see none. Okay, maybe see one, maybe see two. Okay, these tend to be big, and they stain very, very dark purple. Okay, this is what it really looks like. So you see all the red blood cells here? Because remember, you got 4.8 to 5.4 million per unit liter of blood, okay, for each liter of blood. White blood cells, you only have between 5 and 10,000, so you may see none. You might see one, you might see two, okay? But if you go in and you're looking at a blood slide, okay, and you kind of start at low power, right? You gotta start at low power, and you see a lot of purple dots. You know you got a lot of white blood cells, you got an infection. Okay, you gotta figure out what it is. Okay, platelets, right, between 150 and 400,000, these are cell fragments. So you see a bunch of, these are all platelets. This one is a little 5%. A lot of platelets, okay? Right? So this is actually a pretty good schematic here, okay? So we all start out as pluripotent stem cells, then we divide either into myeloid stem cells or lymphoid stem cells, okay? Okay, so we start dividing into red blood cells, or erythrocytes. So we start off as a proerythroblast, and as a reticulocyte, we eject the nucleus, and we get a red blood cell. This is why red blood cells only last 120 days. They do not have a nucleus, okay? And don't worry about how they evolve. Just know we start off as pluripotent stem cells, and then just know like red blood cells or erythrocytes, okay? Okay, so thrombocytes become megakaryoblast and megakaryocytes. Then they break off into like 2,000 pieces. They become platelets or thrombocytes. Their job is to clot blood, okay? So if you have a broken blood vessel, they pack that blood vessel, they make a plug, okay? All right, then we have our granular leukocytes, okay? In an order of abundance, we have neutrophils, eosinophils, and basophils, okay? Their job is to fight infection. White blood cells or leukocytes, they last from seconds to years. So they can divide during an infection, and as they kill the infection, they die, okay? Some of them, like T memory cells, okay, they last your whole life. They last your whole life, okay? Some of these, right, monoblasts divide into monocytes, and these divide into macrophages. We have two types of macrophages. Macrophage, big cell that eats, okay? We have fixed and wandering. So a fixed macrophage, you're gonna find those in your lymph nodes, in your spleen, in your red bone marrow, in your liver. These are like cops that hide in bushes and hide behind signs. So when a speeder goes by, they run out and catch them, okay? The wandering macrophages are like the cops that are on patrol, okay? Going through your town. They go through your body looking for evilness, okay? Looking for evilness, okay? Your lymphoid stem cells divide into T lymphoblasts and B lymphoblasts. They're divided into our T lymphocytes, for short we call them T cells, and B lymphocytes, for short we call them B cells. Some of our B cells will stop off at the spleen, and they will become antibody-producing plasma cells. Plasma cells secrete this chemical called antibodies that kill a wide variety of organisms. Okay, so don't get antibodies confused with antibiotics. Antibodies kill a wide variety of microorganisms. Antibiotics that you get from the doctor will only kill bacterial infections. Okay, if you have a viral infection, you gotta take an antiviral drug. If you have a fungal infection, you have to take an antifungal drug. Okay, if you have a raging viral infection, they may give you antibiotics just to prevent a secondary bacterial infection because your immune system will be down. Okay, so they might piggyback it with that. Okay, all right. So tomorrow we'll start these. So this is just to give you an example. you gotta know, red blood cells are called erythrocytes, I even abbreviate it for you, erythrocytes, okay? Know their job is to transport oxygen and carbon dioxide, know how long they live, 120 days, okay? So all these cells know what their names are, how long they live, okay, and what the job is, okay? It's pretty easy. So we finished this, we'll go over blood typing and stuff tomorrow. So, next week in lab, we'll actually look at blood under the microscope, so we'll show you different diseases, all right? Star with clinical star. Then we do heart, yeah, heart, we actually dissect the heart.